Hi, everyone, and welcome to week 2 of our Social Work Skills Lab. I'm so glad you're here. This week's focus takes us deeper into how we show up as social workers through the language we use, the values we bring, and how we navigate our own presence in the room. These are core aspects of ethical and person centered practice, and they'll shape the way clients experience your support. Today, we're looking at 4 key areas: the NASW Code of Ethics as a guide to our professional behavior, the difference between neutral and stigmatizing language, the power of strengths based language to shape clinical conversations, and the role of self in social work, including when, whether, and how to share your own experiences with clients. Each of these areas invites reflection on who we are, what we communicate, verbally and nonverbally, and how we maintain boundaries while still being our authentic selves. Let's start with neutral language, a skill that's as much about awareness as it is about word choice. Neutral language is descriptive rather than judgmental. It avoids labels that carry stigma or suggest that someone is defined by a problem, behavior, or identity. In social work, our words matter. The language we use shapes how clients see themselves and how we see them too. For example, calling someone a former drug addict or saying they suffer from schizophrenia implies something fixed, heavy, even shameful. By saying someone is in recovery or living with a diagnosis, we focus on experience, not identity. It acknowledges the person first rather than defining them by a condition. Let's take a look at a few examples side by side. Stigmatizing language is former drug addict. Neutral language is in recovery, a person with a history of substance use. Stigmatizing description is ex con. A more neutral take on that is previously incarcerated person. Instead of saying someone is wheelchair bound, describe them as a person using a wheelchair. Instead of describing sex change surgery, use the more positive gender affirming surgery. And instead of describing somebody as mentally ill, consider using the language person living with a mental health diagnosis. This shift may seem small, but it makes a big difference. It reflects respect, dignity, and a commitment to person first, non judgmental engagement. As future social workers, I encourage you to pause and consider, what does this language assume, and how might it land on someone hearing it? Now, let's talk about strengths based language, another key part of ethical and effective communication. Strengths based language focuses on capability, resilience, and potential rather than problems or deficits. It asks what's going well. What strengths has this person drawn on in the past? How can we build on these strengths together? It doesn't mean we ignore challenges, but it means we frame these challenges in the context of growth rather than pathology. Rather than focusing on deficits, problems, strengths based language invites us to see the client's resilience, effort, and capacity for change. It asks us to describe people not in terms of what's wrong, but in terms of what's possible. Here's a quick example. Instead of saying the client is resistant to treatment, we might say the client has concerns about engaging in treatment. One implies defiance or a flaw. The other invites curiosity and collaboration. I'd like to ask you to think about a time, maybe in a previous job, an internship, even a conversation you heard, when a client was described with a negative label. Maybe someone was called manipulative or non-compliant or attention seeking. Now ask yourself, what might have been going on beneath that behavior? How could we reframe it through a strengths based lens? How might perceptions about the client change if they were described as resourceful, self protective, or seeking connection in the only way they know how? This shift in language really matters. It changes how we see our clients and how they see themselves. Now, let's talk about use of self, which is foundational to social work. Duane describes the use of self as the integration of social work training, your knowledge, values, and skills with your personal self, your personality, beliefs, cultural background, and life experiences. That's part of what makes social work relational. We bring our full selves into the room, but we do that with care, intentionality, and self awareness. One key area of use of self is self disclosure, the choice to share something about your own life with a client. Self disclosure is when you share something personal with a client, your own experience, your beliefs, a part of your identity. It's a real part of social work practice, but it must be used with caution and purpose. Primarily, self disclosure should never be done impulsively. It's not something that we toss into a session to seem relatable or to fill an awkward silence. If you're considering making a self disclosure, ask yourself, is this in service of the client? Have I talked this through in advance with a supervisor or colleague? Could I support the client just as effectively in another way? Think of self disclosure as a clinical intervention, not a casual comment. Here's an example of appropriate use of self disclosure. You're working with a teen who feels ashamed of their anxiety and believes they're broken. After multiple sessions and consultation with your supervisor, you decide to briefly share that you experienced anxiety during college and you found therapy helpful. You keep the focus on the teen's experience and check in with how they received it. The goal is to reduce shame, not to center your personal story. Now, here's an example with less helpful self disclosure. Let's say a client mentions going through a breakup and you immediately jump in to talk about your own recent divorce. You share painful details, how hard it was, how your ex acted, and suddenly the therapeutic space is no longer about the client. This kind of disclosure is problematic because it blurs roles, it distracts from the client's process, and it even places an emotional burden on your client. Psychotherapy offers clients one precious hour in the week that is completely about them and for them. Don't steal the focus of the session, even briefly, to make it about yourself. The takeaway, use yourself, but don't make it about yourself. Always circle back to the question, is this helping the client move forward? Let's take a deeper look at the risks and benefits of self disclosure. The truth is, self disclosure can either strengthen or undermine a therapeutic relationship. It all depends on how and why it's used. When self disclosure is poorly timed, excessive, or not clinically relevant, it can shift the focus away from the client and toward the social worker. It can create boundary confusion in that the client may begin to treat the social worker more as a friend than a professional worker. It can lead the client to feel responsible for the worker's emotions. It can reduce the client's confidence in the social worker's objectivity or professionalism. And in some cases, it can even re traumatize or destabilize the client. Sometimes students say, but I just want to be relatable, or it felt like the right thing in the moment. And that's completely understandable. Of course, you want to make a connection with your client. We're all human. But in clinical practice, we're also responsible for using our humanity with intentional and exceptional care. Having said that, there are some benefits to self disclosure when it's intentional, limited, and clearly in service of the client. It can help the client feel less alone. It can reduce stigma or shame. It can build rapport and foster trust. It can demonstrate shared humanity in a way that's containing, not overwhelming. So let's say you're working with a client who's newly diagnosed with a chronic illness and feels terrified about the future. You might briefly share that a close family member went through something similar and found ways to adapt and thrive. You keep the story short, return the focus to the client, and use the moment to deepen connection and hope. Here are a few grounding questions to ask yourself before self disclosing. What's my intention in sharing this? Have I processed this experience fully myself, or is it still emotionally raw? If it's still raw, it's not good to share with clients. Am I clear with what this disclosure is meant to do for the client? Is there another way to support the client that doesn't involve self disclosure? If you're ever unsure, the best thing you can do is consult with a supervisor. That pause can make all the difference between a helpful, ethical intervention and a well meaning misstep. Boundaries are what make the therapeutic relationship safe and effective. It's okay, necessary even, to be warm, human, connected, but it's urgently important to do that within a framework of professionalism. That means knowing when to share and when to hold back. It means keeping the focus on the client, not using the space to process our own emotions. And it means staying aware of our reactions. When a client story hits close to home, it's important to notice that and decide how to respond with care. I've included a short video clip in this week's module that touches on the importance of staying emotionally grounded while still showing up with authenticity. As you watch it, think about how you balance empathy with boundaries. Think about what that looks like in your practice. So that's it for this week's lecture. We've covered big themes: ethics, language, identity, professional boundaries. These concepts will come up again and again and again in your clinical practice. As always, please explore all the materials in this week's Canvas module. Complete your self reflection journal by Wednesday and use it to process your reactions to this week's themes. If you have a question about the course, post in the Ask Questions Here forum. If you have something personal to share, like you need an extension, send me an email directly. Thanks so much for being here, and I look forward to seeing you again next time.